Hello, my name is Dr. Shan Ping Yu. I'm at Emory University School of Medicine. My research interest is mainly focused on ischemic stroke. So as we know, stroke occurred in the United States. 700,000 patients occurred every year. And we have 4.5 million stroke survivors in the United States. So there's an urgent need for us to develop effective therapies for those patients, both for acute stroke patient and the chronic patient. So my research has been trying to develop the treatment in both areas. In case of acute treatment, we have been developing pharmacologically induced hypothermia therapy. So we all know that hypothermia or reduced body or brain temperature is neuroprotective. However, this treatment has been very limited to be used clinically because most likely because the stroke patient usually do not have access to a sophisticated cooling machine. And also our body will be fight against reduced temperature. So shivering is a major problem when you try to cooling down the body temperature. So our novel compound we developed, which can function at the central nervous system, reduce the set point of the temperature regulatory center in the brain. So this is much more effective hypothermic treatment for stroke patient. However, today I'm going to mainly focus on the stem cell therapy that will be most useful for the chronic treatment for the stroke survivors. Because the stem cell therapy can be used many days or even months after the stroke attack. So stroke transplantation therapy has been demonstrated is effective, can improve functional recovery both in animal study and even is demonstrated to be safe in human patients. However, before we can develop effective stem cell therapy in human patients, we also need to address a number of issues at preclinical stage. For example, we know stem cells or neuroprogenitor cells after transplantation into the ischemic brain, the survival rate has been very, very low. And normally people say only 1 to 10 or 20% cell can survive in this harsh environment after ischemic stroke. So one of our approach is to using hypoxic preconditioning to increase the tolerance of stem cells or neuroprogenitor cells, so make them prepared to survive better once they are facing to the harsh environment in the ischemic brain. And we also demonstrate that hypoxic preconditioning can increase some beneficial genes like trophic factors, growth factors. It can also reduce some bad genes like inflammatory cytokines and also decrease cytochrome C release and the caspase-3 activation in those cells, either in vitro or after transplantation in the brain. So therefore, transplantation of hypoxic preconditioning cells has shown many benefits over regular cells. For example, the surviving rate of hypoxic preconditioning cells has been remarkably increased, and their neuronal differentiation is improved. Those cells also show enhanced capability to stimulate neurogenesis and angiogenesis, both from transplanted cells and endogenous stem cells. Another benefit is hypoxic preconditioning can increase migration factors such as SDF1 and CXCR4. So with the increase of CXCR4 in those cells can increase their directed migration to the lesion site, and we see increased number of transplanted cells can accumulate or arrive in the lesion site with improved homing of the cells. Therefore, they can produce much better therapeutic benefit. So we also has demonstrated using electrophysiology to show electric activities damaged by ischemic stroke can be recovered after transplantation of stem cells. Using a number of behavior tests, we also show that transplantation of hypoxic preconditioned cells can give the animal models enhanced functional recovery and improve their performance in sensory motor activities. So it is hoped that with increased the quality of transplanted cells and promoting endogenous regenerative mechanisms, we should be able to develop a more effective, safe, and feasible clinical treatment for stroke patients.